Hi, I'm Dr. Gerald Deas. Welcome to Health Center from Downstate Medical Center. I hope you can hear what I'm saying. I know you see what you're seeing, but I hope you can hear it as well. You know, sometimes on the ship they said, "Now hear this," you know, and people, that means that pay attention and to hear. But suppose you just can't hear it. Suppose you're sitting in the movies and you're only seeing half the movies because it's not loud enough. You got a back seat or so forth. Or say you're in any place where it takes the ear up to be the main thing. Just plain conversation. I mean, just going to a church service, going to a club meeting, anything, and you're getting half the conversation and you're shaking your head because you're embarrassed. Embarrassed because you don't want to say, "I got ear trouble. You know, I can't hear," or going like this, you know. So today we're going to talk about this. You don't have to go here and there or be embarrassed. It can be corrected. Luckily, it can be corrected. And it didn't come overnight. It came through a series of things that they had things from the back of the ear, the inner, this outer ear. They had all kinds of things. The doctor used to use the stethoscope. Even I saw some people use the stethoscope to talk into so the person could hear. Now that's not too cool either. Even the old conch shells, you know, from the water, you get a wave here and so forth. But today we're going to see if we can cut out your embarrassment and to make you feel comfortable and to do the things, even if you might be 90 years old, that you can enjoy things to listen to. So we have one of our specialists here, Dr. Wigan, who is a specialist audiologist who will make this difference if you look at this show long enough. Dr. Wigan.
Thank you, Dr. Deas. Thanks for the opportunity.
Nice having you.
Terrific. Thank you very much.
Dr. Wigan, I know every time you come on the program, I always get a little bio from you so folks know who you are.
Sure.
Because so many different people now are looking at the show.
Right. Well, I'm proud to say that I've been a licensed audiologist since 1998. And I have a doctoral degree from the University of Florida.
Right.
And I've been the chief audiologist here at Downstate since the year 2000.
Right.
And when I came on board at Downstate, we were just developing the newborn hearing screening program.
Okay.
And that was a new law that came into effect in New York State right around that time. So I was on the development team for that program. So I'm pleased to say that all babies that are born in the hospital get their ears checked before they're discharged, and then a few a month we wind up seeing in the office for a follow-up.
Well, you know, my niece was born, and they didn't find out she had hearing difficulties. So they found out in school. Now that's like maybe 5 years old, you know, and she was missing everything, and even sign language in a sense. But people just thought she was a little slow, and you know, and they would cuddle her up and things like this. But just to pick it up at that time of birth is so important.
Of course, yeah. So when we can identify the problem early, we can start remediation right away.
Right.
Okay, and in many cases, if a baby doesn't pass the newborn screening before they're discharged, 8 out of 10 of them will pass at their follow-up visit in my office.
Well, that's wonderful.
And then, of course, that's the best news. That's the highlight of my day when I can tell a parent that the child's ears are working.
Well, that's what my grandson had a problem. He wasn't learning fast enough, and I remember bringing him to there.
Yep, I remember.
Know, sure. And thank God, everything turned out fine. But I mean, hey, you know, it's important to find out things early. But like I was talking about embarrassment, maybe you can talk a little bit about that.
Sure. Well, as you pointed out, if people have reduced hearing or loss of hearing, there are a lot of side effects.
Right.
One of the things that I'm trained to say is that we should check our hearing throughout life to make sure we're hearing our best. Okay. And in many cases, hearing loss can occur very gradually. It's generally invisible. It doesn't hurt. So it just kind of happens, okay, to some people as time passes. And the person themselves may not even notice it, but their families and their social group will notice it. But they may not recognize it as reduced hearing. They may think the person is not paying attention. They may think that the person is having some change in their cognitive function, because a lot of changes that happen with the hearing system can mimic changes in memory or changes in overall mental functioning.
Surely. Now, you know, I took a, excuse me, a master's in public health at the University of Michigan, and it was industrial toxicology and industrial diseases, you know. And every time I see a person on the street with a jackhammer,
Right.
it seems like they don't have no protection,
Yep.
nothing, and I know those people are going to have hearing difficulty down the way.
Right. It's true. Even if they wore adequate hearing protection,
Yeah.
the vibration,
Yes.
you can never protect your hearing from that vibration because they're actually getting it through bone conduction.
Yes.
It's like if you eat cereal or
Yeah.
pretzels, something very
Right.
crunchy,
Right.
you hear that chewing very loud.
Yes.
Why? Because you're hearing it actually through the vibrations in the bone.
Right,
Okay.
right.
I went to a class recently. They talked about the effects of noise on musicians.
Right. So yeah.
And the gentleman that was presenting, he was an audio engineer. And one of the points he made is that when someone uses, let's say, a saxophone,
Yes.
okay, he can protect their hearing at the ear level to try to attenuate or reduce the sound that's coming from the environment to the ear.
Right.
But what he can't fix or can't protect them from is the vibration of that instrument, and then it's transmitting through his bones
Yeah.
and impacting the organ of hearing.
Isn't that something?
Yep.
You know, when I was a kid, the biggest thing with the hearing with young children was mastoiditis,
Right.
where they would get the gland, and more children had their ear open back.
The air cells, the mastoid air cells.
Yeah,
Yep.
and that was the biggest thing. That and tonsillectomies was
Right.
the you got your medals.
The orders of the day, right? Yeah.
You got your medals. And I remember getting my tonsils out, which now they don't even want to bother the tonsils because they are such a protective organ,
Sure,
you know.
sure, of course.
And so we have all these kind of things that are taking place, and here you've made such great advancements in hearing. Maybe you could talk about what we had back here to listen, and here we listen.
Sure.
How little it is.
Sure,
to
sure, of course.
put.
I think what you're really talking about is hearing aids and assistive technology.
Sure.
Okay, so I remember being a young child in church with my parents and seeing like a person in front of me with this gigantic hearing aid behind their ear.
Right.
And I might have been 4 years old.
Right, sure.
You know, so at that age, that's like your anchor. That's your perception
Sure.
of a hearing device.
Right.
Okay. And if I had never seen another hearing device for the next 25 years, that would still be my concept of it.
Oh, yeah, surely.
Okay. The good news is that the hearing aid industry is like the computer industry, the cell phone industry, automobile industry. Every 6 months, there's something newer and better coming out.
Right.
Okay. I actually have some devices that I can show you.
Right.
Okay. So
Before you even get
yes,
to that,
sure,
I
sure.
think that where you could get a lot of folks to come and hear about hearing aids.
Yeah.
If you went to a church and say, how many of you have hearing? Have you heard the whole sermon or the beautiful music?
Right.
You just raise your hand.
Yeah.
I bet half the audience would raise their hand
You're probably right. Yep.
because of the age of the people sitting there
Yep.
who are hiding the fact
Yep.
that they might hear some of the music or some of the words, but they're not being saved.
Yeah.
You know?
Well, that's a great point. One of the drivers of my practice
Right.
is to increase encounters and to increase awareness. Many people check their vision on an annual basis. Many people will go to the dentist on an annual basis. But how many of us check our hearing routinely?
No,
Okay,
not
so what we've been doing with the free hearing screening that we have here at Downstate, we do mailings. We do mailings to churches. Better than that, on a daily basis, myself and my staff, we're going into the different waiting rooms within Downstate.
I see.
And I give like a 1 or 2 minute talk about better hearing, and we invite people to come back to the office for a free 5-minute hearing screening.
Oh, that's wonderful.
And one of the points that I make is that checking your hearing is not someone looking in your ears for 2 seconds with a light.
Right.
Checking your hearing is actually coming to the office to sit in the soundproof room with the earphones on and do a
Sure.
5-minute listening test.
Well, you know, when I talk about the churches, the greatest accumulation of congregation of people is on Sunday morning.
Right.
You know, and I personally know so many ministers. If I would ask him to be able to have 5 minutes of the pulpit time, where I could have a person such as yourself to say the things you're saying here, because everybody's not looking at television
Right.
or internet and things like
Yep.
this. I bet half of that church
Mm-hmm.
would be willing to get that hearing test.
Sure.
You know.
Sure.
So I'm saying take the medicine to the people.
Right.
Or take the
Mhm.
all the
Yeah.
advancements to the people.
Sure.
If you can't do it, and because just little groups, that's fine. But we
Mhm.
need. This is a massive problem.
Right. Well, we could certainly take a look at that and make
Surely.
that happen.
Surely. Go ahead. I'm
be
going
happy
to
to do it.
continue that with the.
Yep. Sure. Okay. So the hearing devices come in different shapes and sizes. Okay. Depending on the hearing levels, depending on the shape of the ear. One of the popular types is like this, where there's a piece that fits over the back of the ear. And we generally can blend that in with the hair color or the color of the eyeglasses.
Yes.
If the person wears glasses. And then there's like a thin tube or a wire that goes inside.
Yeah.
So
And you don't even see it.
pretty discreet.
Yeah, pretty.
There are other types that actually fit all the way into the ear,
Wow.
like an earplug.
Yeah.
And the way that we make these is that we actually measure the ear with some soft impression material.
Right, yes.
We use a 2-part impression material.
Whoa.
And it mixes together as we're inserting it into the ear.
That's wonderful.
And it just stays in there for about 5 minutes. And we have a lab that we work with. We send it out to the lab. And about a week to 10 days, we get the devices back. So it's made exactly to fit the ear.
You know, I know folks that are looking at this show right now, are almost sitting now on the edge of their chair, saying, "Honey, come in and listen to what this doctor's saying. You need a hearing aid," because you know couples don't like to kind of interrogate their
Yes,
loved ones.
right.
Because the man, particularly the man, nothing wrong with my ear.
It's true. We always encourage people to come with their significant other,
Okay.
which is generally their spouse. Sometimes it may be their child. And sometimes I'll have a husband and wife sitting in front of me, and it looks like they're going to go 12 rounds in the ring. They're very frustrated. And the person who has the reduced hearing, they may say, well, she's always yelling at me.
Yes, right.
And then she may say about him, he's always ignoring me.
Tell me this:
Right.
is there a difference in male and female?
There is.
Okay.
About 60% of the adults that have permanent hearing loss are males.
Okay.
Why do you think that is? Men have more hearing loss than women.
Wife yelling at them?
Wife yelling at them? Well, it's really because of occupational reasons, right?
Sure,
So
sure.
men tend to get the noisier jobs.
Oh yes, that's just like I was saying, the jackhammers
Exactly, yeah,
or
exactly.
anything that has a noise attached to it.
Sure.
You know, so basically, is there anything further that you could?
Yes, I
demonstrate?
have a
Sure.
few other things. This is something that we haven't seen before. I'll move it up a little bit. This is a caption call phone.
Okay.
Okay, this is a phone that can operate in any home that has an internet line.
Okay.
The phone is free of charge to people that have loss of hearing. So if we test them, we can certify that they meet the criteria for the phone. And the way it works, when someone calls them, they answer the phone, they turn the caption on,
I see.
and they actually will read what is being said to them
Oh, that's
on the screen.
magnificent.
And people love it. And it's actually funded through public monies. So there's really no cost to the patient. They just come in, they get the test, we can certify it,
Yeah.
and the installer will come to the home and set it up for them normally within a couple of weeks.
That is quite an innovation, because you didn't have this the last time we
Right.
were on.
Yep.
So this may be a rather new development.
Yes,
then.
exactly.
But that's tremendous, and because people, you know, when people are even 80 years old today, they got 20 more years a lot of
Of
times.
course.
You know what I
Sure,
mean?
sure.
And because of certain things, they say, "Well, I don't need it," you know, because I'm not going out or what have you, and things
Yeah.
like this. But something like this in the home would make things so easier, especially if people are living alone.
Right.
You know.
It's, you know, you brought up a great point. You made the comment, well, some people say that they don't really need help with their hearing because they don't go out too much.
Right.
Well, what came first?
That's right.
Did they stop going out or reduce their social activities because their hearing became reduced?
Right. Right.
And they're getting less out of the interaction?
Surely.
Okay. It's never a bad time to hear well.
Right.
So if I meet patients and they have hearing aids from our office, and when we look into the settings of the hearing aids actually tell us how many hours a day they're being worn. So it's a way for us to kind of check and see what's going on. But people will tell me, you know, I only wear it when I go out, or I wear it when I need it. And when we talk about treating the hearing loss, we're really talking about treating the brain.
Yes, surely.
So if people go for a half a day without the hearing aids, then they put them on, the brain has to get readjusted. Every day that the person doesn't use those devices, they're taking a small step backwards.
Yeah. You know, even when you think about it, smoke detectors or things like this, if you're not hearing the alarm go off because of smoke and things like this, not so much the other part of the apparatus that you have, but just hearing that bell go off could mean difficulty for you.
Right. Hearing is important not only for your communication, your relationships, but your safety and your memory as well.
Yes, yes.
If the brain is working overtime to try to compensate for some loss of hearing, there's less energy for the brain to remember and hold on to the information.
You know, this falls into disparity too, when you think about it.
Yep.
So many people don't have insurances. And now with the new things coming along, insurances and things like that, it's going to pay for it.
Right.
Because generally speaking, sometimes folks don't realize that, and so they'll stay away there. So it's too much money. They'll buy a car, but they won't buy a hearing aid.
Yeah, there is a hearing aid benefit within the Affordable Care Act.
Yes.
So it's certainly, you know, it's a door open to those people.
All right.
For sure.
Now, I know that as far as elderly people, do you get much referrals here in the hospital?
We do. We do. I have made it my mission to really get to know a lot of the family physicians, and they've been very receptive to having me come and speak to their patients. They also are referring patients directly. We have expanded our clinical footprint down in the clinical area, so we added a second sound booth about a year and a half ago. So myself and a colleague, we actually can test 2 patients at once. Then we have another room for the consult room, and that's within the ear, nose, and throat department where we have the 7 ENT physicians.
Right. Now, you know, as folks get older, their diet also starts changing, where it becomes a monotonous diet and less nutrients in the diet. Has there been any association with aging, of hearing loss, and nutritional deficits?
Well,
so far.
There are certain dietary recommendations that we make for people that have certain conditions. For example, Meniere's disease or Meniere's syndrome.
Maybe you could explain that.
Yeah, it's basically a syndrome that has 3 symptoms: fluctuating hearing loss, tinnitus or ringing in the ears, and imbalance. And the idea behind that is that there's an overproduction of fluid inside of the balance organ that's inside of the ear. So we do recommend for those patients that they avoid caffeine, salt, and alcohol, and that can, in some cases, give them some relief.
Right. Even headaches, you know, unexplained headaches, or dizziness, vertigo. Is there a lot of folks, as they get older, they think, well, vertigo must be part of aging also.
Sometimes.
But yeah, but I'm talking about from the hearing point of view. That test they do, in fact, I remember bringing someone to you, and you put them on the table, and you.
The Hall Pike test?
Yes, and you shook their head, shook it up.
Okay, so if I could show a picture of the ear, I think I could explain it a little bit better. Okay, so just to review quick anatomy of the ear. We know we have 2 ears. Sounds come into the ear, push on the eardrum. Behind the eardrum we have the ossicles. Those are the 3 little bones, 3 smallest bones in the body, the malleus, the incus, and the stapes. When those bones vibrate, they send a pressure wave into the organ of hearing. Okay, the fluid inside of the organ of hearing moves the receptor cells called hair cells. And in a healthy ear, the receptor cells look like this. They're standing up in rows. They're ready to bend in response to the sound. If someone has reduced hearing or loss of hearing, it's generally because there's a dysfunction or a diminished function within the hair cells.
What do those hair cells consist of? Is it a protein, or is it a muscle cell?
It's like a microcilia. And in the balance organ, so in the inner ear you have the organ of hearing and also the organ of balance, which consists of the 3 semicircular canals. So there are also hair cells inside of those semicircular canals, and then when we move, if we move our head in one direction, the fluid inside the balance organ moves and it bends those receptor cells. The hair cells within the balance organ have a weight on the end of them called an otolith. And sometimes as folks get a little bit older, that weight can break off, and it becomes almost like an ear rock, basically, just to put it in a very general term. And these floating rocks within the ear can cause people to feel this benign paroxysmal positional vertigo, or as you said, they get up quickly, they turn over in bed, and they feel like the whole room is going.
That's right. Yes.
Yeah.
You know, when I was a kid, and we had poles in our yard because our parents hung the clothes on the pole, and sometimes the cat would climb that pole and go to the top of that pole, and everybody would be standing. Nobody was going up the pole because you couldn't get up to the cat. But if that cat fell off that pole, it always landed on its foot.
Amazing, right?
It must have a tremendous equilibrium set to go into action immediately. Isn't it interesting?
Sounds reasonable.
Yeah.
Yeah. The long tail probably helps too, with the balance.
I don't know, but the balancing act of that cat falling off that pole was amazing. You know, they said, don't even worry about it. If it falls, it'll fall on its 4 feet.
Amazing.
You know, yes.
Amazing.
In closing, I know that we have a short time, and time is always our enemy here. However, we could go on and on and on. Maybe you could give just some general rules now about hearing and about who should really come in to have the hearing.
Sure. Well, this month, I'm just going to hold up our mailer. We have a free hearing screening event this month for the whole month of April, okay? And the number is there. Even if you're watching the show and the date has passed, we will still extend the free screening. It's a free screening program for adults.
All right.
Okay, any adult is welcome. We do see walk-ins. It is better if people will call to make an appointment to minimize their waiting time. And really the best time to check your hearing is now, is to check it throughout life to make sure you're hearing your best.
Right,
It's better to be proactive.
Now, years ago, they used to have hearing tests in schools periodically. I don't see it anymore.
Yes, my understanding is that that was done away with, and the philosophy of the educational system is that they're going to leave healthcare to the healthcare practitioners.
De Blasio, do you hear this? De Blasio, getting all these charter schools, all these schools, you know. Maybe we should be bringing back that, because I remember how they used to put these things and see whether you could hear, you know. So there it goes again. No, if you can't hear the teacher, how are you going to pass?
You'll never learn to read.
Learn to read.
We can't sound it out.
Okay. Isn't that amazing, though, how politics and all of that thing works together for the good that love the Lord. And so basically, to all of you out there, I would suggest strongly to, get that hearing test. Talk to your minister. We can have somebody come by and test you on Sunday morning.
Sure.
Because not Sunday afternoon now, not Saturday because you're shopping, and Sunday afternoon you're going home to eat dinner. But during the service, I would say we could arrange for that kind of thing. And you'd be surprised. They'd be clapping their hands because they could hear the music. So I want to thank you, Dr.
Wygand. Thanks, Dr. Deas. Thank you. Thank you. Thank you.
Coming here, giving all
thanks
these
for having
practical
me.
aspects
Terrific.
about hearing. And I hope that that we can encourage people to continue to go along with you. And it's because in your field itself, is there many trained in your field particularly?
We are approaching a shortage in the profession.
Oh boy.
The incoming graduates are not adequately replacing people who are either retiring or leaving the field.
And what does that cause, you think?
Well, I think our field is dominated by women.
All right.
And there are obviously family obligations. A lot of women work part-time in some cases.
Yes.
And what we're seeing now, the baby boomers are coming of age for retirement, so it seems like the demand is increasing.
Yes.
So we're really trying to hire, a lot of staff in the office to keep up with the demand.
Right. But we have so many programs in this school at Downstate.
Exactly.
I don't see why that shouldn't be part of any of these programs to introduce, because they just don't know. The students who come in here, they don't know what fields, even the PAs,
that it's around.
Physician assistants, and physician's assistants are going to see many more people than the doctors because they're always there, taking care of. They're the foot doctors,
Sure.
And the foot doctors can pick it up as quickly.
Of course.
And I'm sure after having a teacher like yourself, and there's so many in this school right now would like to train or be trained in this field.
Absolutely.
You know, because it'll only increase when you talk about disparities, it's disparities in hearing. You know,
Right.
so basically they have a disparity program right now in the school going on right at this moment we're talking.
Yep.
It would be a very important thing for you to be on that, have been on that program too.
There's always next year.
Next year. But I want to thank you for
Thanks, Dr.
coming,
Deas.
you know. And to you folks out there, it's no joke when you can't hear. It's no joke when you can partially hear. And it's without earplugs, you know. So we don't, and of course, people today are having all kind of sounds. The kids that are walking through the streets with that thing in their ear, believe me, they're going to find out there's a disconnect. There's a disconnect even going with hearing and those sounds that are coming through that ear every day. And they're not being tested. They're not being tested before they put that sound thing in, and maybe after they put that thing when wear it for a few years. And so I think your children should also be tested, because hearing loss is progressive. It doesn't stop when you take the ear things out. You've done the damage, because the little hairs in there are so fine that when it goes like this here, you won't be able to hear. See you the next time.